Google plans to put a PC in every pocket, screamed the headlines on the front page of the business section of the New York Times. Quotes, "What Apple began with its iPhone, Google is hoping to accelerate with an ambitious plan to transform the software at the heart of cell phones. The personal computer is climbing off its desktop perch and hopping into the pockets of millions of people," close quotes. That was the article's opening salvo. And by the way, Google plans to give away the software using the same open platform strategy that has given Microsoft such a bad case of heartburn in the past. Tools are being made available to software programmers to spur new ideas and applications. Hold on to that thought for a moment and let's consider your personal medical record. Now, it wasn't long ago that America's leaders in medical informatics, in government and academia, were content to debate the challenges of moving to electronic medical records from the paper reports in hospitals and hospital systems. They aspired to improve accuracy and efficiency by converting paper-based systems used by doctors, nurses, and hospitals to electronic formats. Now, that's a worthy goal. But as leaders diligently began this conversion, the environment began to shift under their feet. In fact, by 2005, it had become quite clear to many leaders in the field that the record properly resided with the patient, from whom health data emerged, and that the data that flowed through the hands of hospitals, doctors, and nurses was only part of the overall picture. Thus, the concept of a personal health record has gradually subsumed the vision of the electronic medical record. That's a good development. The personal health record combines data, knowledge, and software tools which help patients become participants in their own health care. But if we are truly to anticipate where healthcare trends are taking us, even this isn't enough. It's now clear that in a truly preventive system, health is not a collection of late-stage reactive interventions. That kind of thinking will soon be a relic of the past. Rather, health should be defined as a life fully lived, hopeful, productive, fulfilling, rewarding, and manageable. The determinants of such a life begin before birth, embedded in the healthful behaviors of one's future parents, and they extend beyond death to one's survivors. Considering this broader view of health, the right concept for our health record system should be a lifespan planning record, or LPR. The LPR for a single individual born today could extend out at least 100 years. It would include all of the baseline medical information needed by patients and much, much more. It would consider economic, social, educational, and spiritual goals and milestones, as well as the medical and scientific objectives. Born today, the newborn child's plan would already be inhabited with a great deal of information. Some reasonable compilation of the records of parents, grandparents, and siblings would be represented. Future diagnostic and preventive therapeutic measures based on familial information would be flagged on the timeline. Print, video, and graphic information from other accessible intelligence databases would be seamlessly interwoven for easy use by people caring for each other and this new global citizen. As time passes, this living record would flexibly grow and adjust to assist informed decision-making, preventive behavior, and full and complete human development. Where will the knowledge come from? Patients obviously will need to contribute to the personal side of the record. On the health and science side, it will emerge from 3 electronic data sources: the clinical research data space, the continuing professional development data space, and the continuing consumer education data space. These data sources will desegregate and converge upon each other to allow integrated use of information they contain by the people and the people caring for the people, as well as investigators searching for new solutions to today's unresolved problems. Now, obviously, many issues will need to be sorted out, not the least of which are confidentiality, patient privacy, and control over these records. But Google's most recent action addresses one obstacle that has provided comfort to those who control healthcare's traditional power silos: the notion that consumer health information could never be hijacked by a burgeoning consumer health movement. Why not? Well, there wasn't enough broadband width, they said. Second, people, especially those with a high burden of chronic disease or those challenged by socioeconomic factors, often don't own computers or have trouble using them. And third, even if they had them and could use them, medical knowledge is way too complex for everyday people to manage. And finally, where would the data go? There's no killer application called a lifespan planning record as an icon on my new computer. Everyday people doing Medline searches get real. But as experts continue to reassure each other that their command and control systems are stable and will only change in incredibly small increments, the people at Google and elsewhere are not playing out of the same game book. As traditional leaders sleep, broadband, wireless, and WiMAX have now spread everywhere. Connectivity is now ubiquitous and strategic. New alliances are forming horizontally, vertically, and every other way. The LPR, in one way, shape, or form, that killer application with transformative power, is causing entrepreneurs to salivate in dozens of companies. And open platform software with instruction books just up the ante. And as for computer availability and computer literacy, no problem. Google believes the people will use their cell phones. Everyone has one and knows how to use it. And the nice thing is, they travel with us. For Health Commentary, I'm Mike McGee.